Welcome to the Diversity Connector podcast, where we explore the rich tapestry of human experiences. I'm your host, Gertrude Mache, and I'd like to acknowledge the traditional custodians of the country on which we meet today. I would also like to pay my respects to elders, past, present, and emerging, and together as we dive into conversations that bridge cultures, challenge stereotypes, and celebrate the unique perspectives each of us brings to the table. Each episode is a journey through stories and insights from a kaleidoscope of voices, each sharing their colorful narrative. Whether you're at home, on the go, or just anywhere in between, you're now part of a community that values understanding, inclusivity, and the beauty of diversity. So plug in your headphones, get comfortable, and let's connect through the power of our shared stories. Welcome, and thank you for joining us on the Diversity Connector podcast. Hello, everybody, and welcome back to the Diversity Connector. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another fascinating guest. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, and share your story with us today.
All right, thank you for having me also. I'm Antonio Webb. I am an orthopedic spine surgeon here in San Antonio, Texas. And I essentially practice and treat patients that have issues with their neck or their low back or their mid back. So I take care of a lot of patients that have degenerative as well as traumatic injuries to their neck and back. My journey kind of started off in the military. I joined the military at age 17, and I spent 8 years in the U.S. Air Force. I went to Iraq in 2005. We deployed there, and my job in Iraq was essentially a medic. So I took care of a lot of wounded soldiers and saw a lot of bad injuries while we were there. After the military, after the 8 years in the military, I went to medical school at Georgetown in Washington, D.C. I did a 5-year surgical residency here in San Antonio, Texas, and then I did a 1-year spine fellowship. And I've been in practice for about 4 years, and that's kind of who I am and kind of what I do.
Now, you have had quite a journey as an African American in the field of orthopedic spine surgery. What are the challenges that you have faced due to your background?
I think one of the biggest things is the lack of people that look like myself. In the field of orthopedic surgery, there's some statistics that show that less than 1.9% of orthopedic surgeons are African American. So here in the city of San Antonio, it's just a handful of us. And I think that's a big problem because patients need to be treated by providers that look like them. And there's been multiple studies that state that patients do better when they're treated by clinicians that look like them. So I would say that, as well as lack of mentorship. I would feel more comfortable with someone who looks like me and someone I can relate to as a mentor. So I think that's probably one of the biggest challenges is finding someone who looks like me.
So how did your experiences in the military influence your approach to promoting diversity within the medical field?
Well, I think the military is just it was certainly part of my journey to actually get to this point. Everything that I've learned in the military actually helped me be successful in medical school, which was really challenging, and residency and the fellowship, and kind of along this journey. So a lot of the things that I've learned, the discipline, the rigid schedule, just being I would say the resilience that I've learned while in the military, I've utilized a lot of those skill sets to be successful, and that's really helped me, especially in a surgical specialty.
So, what inspired you to establish the Webb Family Foundation, and how does it address the issues of underrepresentation in medicine?
Yeah, so the Webb Family Foundation is a 501c3 nonprofit organization that is essentially to increase diversity in medicine. And I started this after a study came out in 2014, I believe 2015, that showed that there were more African Americans in medical school in 1978 than there were in 2014. So I saw those alarming statistics, and I really wanted to. Would you mind coming back? Sorry. I saw those alarming statistics, and I really wanted to try to change that. So the nonprofit is essentially to increase diversity in medicine and essentially aspire, expose, and introduce various fields in medicine to students that want to become physicians. So this year we had a summer mentorship program where students were able to hang out with me in surgery and in clinic and just get some hands-on experiences, as well as I had a health career day recently, I think last month, where we had over 100 students that were registered, and I had a lot of physicians, my friends that came in and that were cardiologists, ER doctors, dermatologists, allergy doctors. We had an optometrist, medical sales reps, and essentially just to expose kids to various fields. And a similar program to that actually got me interested into the field of medicine, and is the reason why I'm a doctor. So that's why I'm so passionate about doing that.
Now, can you discuss the importance of mentorship in your career and how it's shaped your efforts to support the next generation of surgeons? Who were the people that came around you, who supported you along your journey?
Yeah, it's been countless people. Starting off in medical school, I would say the dean of my medical school, Dr. Dean Taylor, who's been a really instrumental part kind of in my journey, who's even a mentor kind of to this day, who unfortunately recently retired. So, but I'm still kind of in contact with him, and countless other people that I've met along this journey. And as I mentioned, there's not a lot of us kind of around. So when we see each other, it's kind of an automatic kind of connection that we have. So it's certainly lots of a lot of other surgeons that have come before me who kind of has mentored me along this whole journey and helped me get to the next step. And that's my motivation, to kind of help the next person. So that's what it's all about. Once you get somewhere, you reach back and help those that are coming behind you.
I love that. Now, how has partnering with Dr. Idionwe, a former mentee, influenced your efforts towards creating a more diverse medical community?
Yeah, it's been good. Dr. John Way is, I've known him since he was a medical student and I was a resident. So I think I'm about 4 to 5 years ahead of him. But ever since along this journey, we've stayed in touch, and I believe the reason why he went into spine surgery was because of our kind of interaction, which was good. And it's good to have him as a colleague and to collaborate on a lot of different cases, and also bring a lot of the newest technology and innovation that is out there in terms of spine surgery to this area. So yeah, it's been a great collaboration, and it's been good to have him not only as a mentee, but now a former mentee, but now as a colleague.
That's amazing. So, what barriers do you think still exist today that prevent more diverse workforce in orthopedic surgery, and how can they be overcome?
Yeah, I would say that there's a lot. So I would say early access and exposure. Some kids, young students may not have just that foresight to be able to see certain things. And I certainly did. I did growing up. I didn't see any Black doctors growing up, and there wasn't really like YouTube, or I can go on Instagram or Facebook and see doctors that are doing their day-to-day thing and showing us what they do for a living. So I think early exposure is really critical, and that's kind of my passion is kids that are middle school, high school students, college students, and just showing them essentially that this field is a great field, and it's certainly something that is very gratifying, and it's certainly something that's obtainable, because some students may not even think that it's obtainable, but as a surgeon, I can sit and kind of guide them and show them that it is possible to do that. So I think early exposure, I think lack of mentorship is a huge problem. And I would also say just having the tools to just navigate this whole process, because it's a challenging process, and nobody in my family is a doctor. I have a lot of my colleagues who their mom's a doctor, brother's a doctor, sister's a doctor, uncle's a doctor. Everybody in their family is a doctor. So that going down that journey may be easy for them, but for a lot of us who have very similar skin colors, we don't find it sometimes that easy.
So tell us a little bit about your family and your upbringing. Who were the foundational people in your life who helped you along the journey? Your parents, your mother, your father, who did you have around you who helped you to get to this point?
I would say, and kind of going along that old adage that, it definitely takes a village. So it was a lot of my family members, my dad, who grew up a really challenging background, and he did some time in prison, and when he was younger. My mom, she was in and out of the house kind of growing up. She was actually shot, and she's paralyzed from her waist down due to her drug addiction, something that she's battled for a long time. So she was in and out kind of throughout my life. So a lot of my aunts and uncles and my grandmother kind of helped pitch in and kind of raise my three siblings and I. But yeah, growing up in Louisiana, it was definitely something that I knew I didn't want to stay in that type of environment and go down that same path as my friends and family.
Now, can you share a success story from your foundation that illustrates the impact of your diversity-focused initiatives?
Yeah, so I would say, I'll speak on this past Health Day event. I had an event where students were able to come and just learn about various specialties and have a lot of hands-on activities for them, different instruments and things that we use in spine surgery, and look into the eye, learn how to do CPR. But I would say when a student came up to me and said that he was going to medical school because of my videos and kind of things that he's seen kind of on YouTube and online. So that's kind of what I live for, and what my passion is for students to come up to me and say, "Hey, doc, I'm a doctor because of you, and your book, maybe your YouTube or something along those lines, kind of inspired me to just keep going." And I get that pretty frequently.
Yeah, I guess now with the advent of social media, one can have a wider reach, especially with young people. So what are you doing on social media to connect with the next generation? Where can people find you? Do you have a YouTube channel? What kind of information are you pushing out through social media?
Yeah, I try to put out quite a bit, and just showing what the life is like as a spine surgeon or orthopedic surgeon.
Mhm.
So on Instagram, on YouTube, a little bit on Twitter, TikTok. Might just type in my name, Antonio Webb, MD, or Dr. Antonio Webb, and something of mine should show up. But mostly try to focus on YouTube, and that's what my passion is film and cinematography. So I love the editing process, the shooting, the creating process. That's where most people can find me. But I just try to put out inspirational things, and also different videos or content relating to what a spine surgeon, what do I go through on a daily basis, performing surgery and seeing patients in office, seeing patients after surgery. So that's what I try to put out.
Yeah, that's just amazing, because until you see someone who looks like you actually doing the work and walking the talk, it's not easy to believe that you can actually do it yourself. So that's
Yeah,
just
that's very true.
fantastic.
Yeah, very
Now,
true. And then going back to your, Sorry, going back to your original statement about the reach, very powerful. You're in Australia, which is pretty far away from here,
Yeah.
and being able to just speak to you and just reach people that are in Australia and different countries. And I'll put out a video, and a couple minutes later, I'll get an email from someone in India or Nigeria or China. I mean, the list kind of goes on. Very powerful.
Yeah, the world is flat now because of the internet. And for those people who are harnessing the power of the internet, we are literally just a connection away now. So your inspiration is filtering way beyond the United States. I'm pretty sure there's a lot of African youth who are going to get in touch with you because of the work that you're doing online. Now, how do you think institutions can better support the inclusion of underrepresented groups in medical schools and advanced specialty programs?
Well, I think comes down to a lot of times funding and support. So, unfortunately, a lot of the programs here in the U.S. they're starting to cut back on those programs or even penalize schools that have these diversity programs. They're shutting down a lot of the offices because of some new laws here in the U.S., which is very unfortunate because that's kind of our safe haven. In a huge organization or school, those places are where we go out and spend time with other students that look like us, and that's one of the places that we can get some support or because I mean, I think it's a huge loss to have a lot of those programs get defunded. So I think funding is really critical, and just the support from the head down, from the dean of the school, the CEO of the organization, the president of the organization, to be able to just support and kind of move these initiatives along.
Now, your experience in the military, that was a route that you took that helped shape your career. What did that actually do for you as a person? Because it takes a lot of discipline to be in the military. What were some of the things that you learned the most about life by being in the military?
Great question. Time management, and I would say that's really critical, a really important skill set to have as a surgeon. There are a lot of different things I'm responsible for in terms of surgeries. Tomorrow I'll be operating till probably 7 or 8 o'clock at night, and I start at 6:30 in the morning. So the notes, the operative reports, being able to just decipher kind of all of the imaging that I see and dictate that into the patient's chart and insurance requests. So the amount of information and things that we have to do kind of it piles up as we go along, and you really have to be you have to have time management skills. And I would say I also took away just the discipline. My schedule was really disciplined throughout the day, and I know exactly what I need to accomplish. That's what kind of the military taught me is just having that structure. In the military, we got up at a certain time. We had to make our bed at a certain time. Our
Mm.
shoes had to be a certain way and shined. They expected our uniform. So a lot of different things that I kind of took away, and which really allowed me to kind of grow up and just be a better person and better man and a better surgeon, better father, just from my time in the military.
I love that. Now, juggling your profession and your family and personal life can be challenging. You mentioned that you're a father. How old are your kids? How are you juggling such a demanding workload and your personal life as well?
It's hard, and I certainly I would be lying if I say I didn't struggle. I have 3 kids. One is 2, one is 5, and one is 13. And as soon as I end this interview, I have to go pick up my kids and take them home and get them dressed, get them fed because my wife's out of town this week. So all of the duties are on me this week, which I have a very busy surgical week and a lot of surgeries this week. So it's going to be a busy week, but I think I've learned that when I go home, they don't really care, how tired daddy is. They don't care, how much work I had or how stressed I am about a surgery if I had a complication. And I'm really worried about a patient. They just want time. They want to spend time with daddy. They've missed daddy. So when I go home, that's my second job. And I spend time until they go to bed, and I have a couple of minutes where I have to spend time with my wife, and which is unfortunate sometimes, but we're in the thick of it. I know things will get better as we go along. With having two kids and little kids and still in diapers or nighttime diapers for my 5-year-old, but it's hard, and but I enjoy it, and I know that my kids are enjoying this process also.
It's just awesome. Now, looking forward, what changes or developments do you hope to see in the medical community in terms of diversity and inclusion in the next decade?
Well, I think it's, my goal and what I hope to see is that it's a more inclusive kind of workforce, and it's one that's that is able to keep up with the demands of the ever-changing population. I mean, we serve a very heterogeneous population with a very homogeneous workforce, meaning that the people that are taking care of our patients, there should be um, equal representation of the provider. So patients come seek me out and come see me just because of they feel more comfortable with me. And there's been studies that show that patients that are treated by providers that look like them, they do better and they adhere to their treatment recommendations from a clinical standpoint. So I hope that we can increase the numbers. Less than 1.9% of orthopedic surgeons that are African American. That's a really disturbing figure there. And I hope that we can change that, and a lot of the initiatives that are going on, and social media and just getting information out there, hopefully that can help as well.
That's fantastic. My last question for you, because I know you have to go and pick up your little ones, is if I could take you back in a time experiment and we could go back and meet the younger you, the young boy who went into the world, went into the military, ended up being a doctor. If you could go back and give him 3 nuggets of wisdom based on what life has taught you up until this point, what would you have wanted somebody to have told you before you started this journey?
I would say enjoy every step of it. I mean, life is very very precious. Along this journey, I've spent so many years kind of studying, and I spent so many days just locked up in my. It's unfortunate, but locked up in my office or my desk, and you know, um, neglected a lot of personal relationships, and you have to make some sacrifices. And I know some days in medical school, I was studying 13, 14 hours, and that's just what I had to do to actually get through it. And I remember one time in medical school, I was in my room for 3 days straight. And when I came out, I kind of squinted because it was so bright outside. I was like, wow, I haven't been outside in 3 days.
Wow.
But there are a lot of different issues that can come out of that. And that's a whole different topic with depression and burnout and anxiety and suicide and physicians is huge. It's a problem. Nobody really talks about that. But I would say enjoy every step of it, and try to find some balance. And you have to have balance in the medical field. You can't be 99% medical and 1% everything else.
Yeah.
And that's what mistake that I've done along this journey has just been so focused on getting to this point where I've neglected a lot of other things, including my health at some points.
Mm-hmm.
So I would say find some balance, have a strong support system, and just enjoy every step of this whole process, because it's certainly been a journey.
Fantastic. Well, thank you so much for coming online and sharing your story with us today. And thank you to everybody who's tuned in. The Diversity Connector is a platform that brings you the stories and voices of people from all over the world. We share our stories to uplift you, inspire you, energize you, but most importantly, to empower you with knowledge. So tune in again tomorrow when I interview yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world, and bye for now. Thanks again, Dr. Webb.
Thank you for having me.
And that's a wrap, everybody. on today's episode of the Diversity Connector podcast. Thank you for tuning in and being part of our vibrant and global conversation. I'm your host, Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a tapestry of diverse perspectives. Remember, every story you've heard today is a thread in the larger fabric of our shared humanity. So, as you step back into your world, carry these stories with you and let them inspire you to embrace and celebrate the rich diversity around us. Don't forget to subscribe, rate, and review our podcast to help us share these inspiring stories with more listeners. Do follow us on social media by looking for the Diversity Connector podcast for more updates. Until then, keep connecting, keep listening, and keep celebrating the beauty of diversity. This is the Diversity Connector podcast signing off. Stay curious, stay open, and definitely stay connected.